Todd.
Hey, nice to meet
Ryan, how are you doing today?
you. Doing really good.
All right, well, I have your report of findings that we completed, and I'm just going to go over the details that we have found. You had mentioned you came in with an accident, a ladder accident, about 2 weeks ago. You've been having some low back pain.
Correct.
Okay. Is that that the pain, you said it was radiating down your leg, and you described it as a dull, aching pain?
Yeah, it's usually more of a dull, achy pain, but sometimes it can get kind of sharp. Yeah.
Okay. Well, we did, on our physical exam, we did find some decreased range of motion in the flexion extension, and also in the lateral rotation and bending of your spine and the lower back. So what we'll do is we'll actually work to improve the motion in that area. We did also find there's some decreased range of motion in your spine, in the cervical and the neck region. And so we will also address those issues as well. And do you sit at a desk a lot at work, or sometimes that can impact the neck region?
Yeah, I do tend to sit at a computer.
A lot of computer work can definitely have an impact on your in the neck region, causing some discomfort there. So we can certainly help with both of those areas in your spine. Many times what happens is called a vertebral subluxation complex. And this is a condition when the spine begins to malfunction, and it can cause imbalances or damages to the nerve tissue. There's 5 different components of this process. The first one is reconstructive care, and what we'll do is we'll go in to correct those issues and to help to return your health to its optimal level. There's a neuropathophysiology, and this is an abnormal change in the function of the nerve, and sometimes when the vertebrae begin to misalign, it causes pressure on the nerve roots, and this is where you experience a lot of the pain in your lower back. The third component is a myopathology, and this would be abnormal changes in the muscle tissue, in the supporting muscles. Have you been having any muscle spasms in your back?
Yeah, I have had
or weakness, muscle weakness. So this would, chiropractic would actually go in and address those issues and help restore the supporting muscles, and it would help with the spasms and weaknesses of the muscle tissue that you have in the lower back. The fourth component is histopathology. This would be abnormal changes in the soft tissue, and there's 3 different phases of this component. Phase 1, it would be the serious component. Phase 2, severe, and all the way to phase 3, which is extreme. In your particular case, we did find that you're between phase 1 and phase 2, which would be from serious to severe. And so this would be beneficial to help address and keep it from progressing to a more extreme phase. The 5th component is spinal pathophysiology. There's 4 different phases of this component. The first one is the misalignment and malfunction. Not any soft tissue degeneration in phase 1. And we did find this in the cervical region in your case, beginning stages of malfunction. The phase 2 would be a misalignment with soft tissue calcium deposits beginning. And this is what we found in your lower back region, somewhere between a phase 2 in the pathology. And then phase 3 would be misalignment and malfunction, where the bones begin to fuse together, all the way to phase 4, which is total bone fusion.
Okay.
The good thing is that we are catching this early. We can help reverse a lot of the degeneration that's already occurring, and also we can help stop it from progressing or becoming worse.
Okay.
What we would recommend for you is if you can to come in 3 times per week for 4 weeks, and then following that, we begin to taper off to 2 times per week for 6 weeks.
Okay, sounds good.
Okay. And, you know, the recovery process for phase 1 and phase 2, which is where your condition would fall. In phase 1, we would expect a complete return to normal condition in your cervical spine, and then for your lumbar lower back, we would expect a return to near normal, and we would expect the calcium deposits to stop occurring. So we would stop the degeneration process. And so this is all about coming and having the misalignments corrected, about lifestyle, and then, you know, of course, compliance with the recommendations. So we are just glad you came, and we expect optimum recovery for you, and your health is our primary concern, and we just look forward to helping you achieve your optimal health goals.
Thank you so much.
Thank you.